Hello, I'm Dr. James Wilson, and welcome to Senior Vitality Clinic. Today we're going to tackle one of the most common questions I hear in my practice. Is this feeling a side effect from my medication, or is something else going on? If you're over 60, chances are you're taking at least one prescription medication, and many of you are managing several. According to the CDC, nearly 90% of adults over 60 take at least one prescription drug, and almost 40% take 5 or more medications. That's a lot of chemistry happening in your body. Here's why this matters. Missing a serious new health problem because you think it's just a side effect can be dangerous. But calling your doctor every time you feel slightly off can lead to unnecessary worry and tests. Today, I'm going to give you a practical framework to help you make better decisions about what deserves immediate attention and what you should monitor. This information is educational and should never replace personalized medical advice from your doctor. Think of this as a tool to help you have more informed conversations with your healthcare team. Let's start with why this question is so tricky, especially after 60. Why this gets confusing: your body processes medications differently as you age. Your liver and kidneys work less efficiently, which means drugs stay in your system longer. You might experience side effects at doses that wouldn't have bothered you 10 years ago. This is completely normal, but it makes the picture more complicated. Here's another layer. Many health conditions common after 60 have symptoms that look exactly like medication side effects. Feeling dizzy? That could be a side effect from your blood pressure medication, or it could signal a heart rhythm problem, dehydration, or inner ear issues. Feeling tired? Could be your antihistamine, or it could be anemia, thyroid problems, or sleep apnea. Common misconceptions that can hurt you. Misconception number 1. Side effects only happen in the first few days of taking a medication. Reality: while many side effects do appear early, some take weeks or months to show up. A medication you've taken safely for years can suddenly cause problems if your kidney function declines or you start another drug that interacts with it. Misconception number 2. If it's listed as a side effect, I should just live with it. Reality: just because something is a known side effect doesn't mean you have to tolerate it. Many side effects can be managed by adjusting doses, changing when you take the medication, or switching to an alternative. Misconception number 3. Natural supplements don't cause side effects. Reality: supplements are chemicals too. St. John's wort, ginkgo biloba, and even high-dose vitamins can cause symptoms and interact with your prescriptions. Why this matters more after 60. According to research published in the Journal of the American Geriatric Society, medication-related problems account for nearly 30% of hospital admissions in people over 65. Many of these could be prevented with better monitoring and communication. The stakes are higher because your body has less reserve. A younger person might feel queasy from a medication and push through it. But for someone over 60, nausea can lead to dehydration, which can cause confusion, falls, and a cascade of other problems. Timing: your first major clue. The timeline of when symptoms appear gives you crucial information. Within hours to 3 days of starting. If you start a new medication and develop symptoms within the first 72 hours, side effects are the most likely culprit. Common examples include stomach upset or nausea, mild dizziness or lightheadedness, headache, fatigue or drowsiness, dry mouth. However, and this is important, even during this window, certain symptoms should never be dismissed as just side effects. Call your doctor immediately if you experience severe allergic reactions, hives, swelling, difficulty breathing, chest pain or pressure, severe abdominal pain, sudden vision changes, confusion or difficulty speaking. After 1-2 weeks, some side effects take time to develop. For instance, statins can cause muscle pain that doesn't appear until you've been taking them for several weeks. Diuretics might slowly deplete your potassium, causing muscle weakness or cramping. At this stage, it becomes harder to separate side effects from new problems. Did your knee start hurting because of a statin side effect or because you overdid it in the garden? This is where keeping good records helps tremendously, after months or years. Don't assume that because you've taken a medication successfully for a long time, it can't suddenly cause problems. Changes in your body can alter how drugs work. Your kidney function naturally declines with age, about 1% per year after age 40. This means medications that your kidneys filter out start to accumulate more than they used to. New medications can create interactions with drugs you've taken safely for years. Changes in diet can also affect medications. Starting to eat more leafy greens can interfere with blood thinners. Cutting back on salt can intensify blood pressure medication effects. Pattern. What makes symptoms better or worse? This is detective work, and you're the detective. Questions to ask yourself. Does the symptom get worse at a specific time of day? Many medications have peak effects 2 to 4 hours after you take them. If your dizziness happens like clockwork every morning, 2 hours after your blood pressure pill, that's a strong clue. Does the symptom improve on days you forget your medication? I never recommend skipping medications on purpose, but if you accidentally miss a dose and notice you feel better, that information is valuable. Tell your doctor. Does the symptom happen with specific activities? If you only feel short of breath when climbing stairs, that's different from feeling breathless while sitting. The first might indicate a heart or lung condition. The second might be more consistent with a medication effect. Is the symptom constant or does it come and go? Side effects that come from blood levels of medication often follow a pattern. Worse when drug levels are highest, better when they're lower. New health problems tend to be more constant or progressively worsening. Severity. How much is this affecting your life? According to the American Geriatric Society, this is one of the most important factors in decision-making. Mild side effects, slight drowsiness that doesn't impair your function, mild dry mouth, minor taste changes, mild constipation that responds to increased water and fiber. These might be worth tolerating if the medication is effectively treating a serious condition. But always mention them to your doctor. There may be simple solutions. Moderate side effects, nausea that reduces your appetite, dizziness that makes you unsteady, fatigue that limits your activities, muscle aches that interfere with exercise. These should not be ignored. Talk to your doctor within a few days. There's often a way to adjust treatment. Severe side effects. Any symptom that prevents normal daily activities. Symptoms that frighten you. Anything that affects your safety. Severe dizziness, confusion. Symptoms that are getting worse. These require immediate medical attention. Don't wait for your next scheduled appointment. The never ignore list. Some symptoms should always trigger an immediate call to your doctor, regardless of whether you think they might be side effects. Cardiovascular red flags, chest pain, pressure or tightness, irregular heartbeat or heart racing, severe shortness of breath, swelling in both legs, especially if new or rapid, fainting episodes, neurological warning signs, sudden confusion or memory problems, difficulty speaking or understanding speech, vision changes in one or both eyes, severe headache, especially if different from your usual headaches, numbness or weakness, especially on one side, these could signal a stroke. According to the American Heart Association, every minute counts with stroke symptoms. Serious bleeding, blood in urine or stool, even small amounts, coughing up blood, unusual bruising, bleeding that won't stop. Many seniors take blood thinners which can cause bleeding, but bleeding always needs evaluation. Mental health changes, new or worsening depression, suicidal thoughts, severe anxiety or panic, unusual behavior or personality changes. Some medications, including steroids, certain antibiotics, and even sleeping pills, can affect mood and thinking. This needs immediate attention. Medication-specific patterns. Let me walk you through some common medication classes and their typical side effects versus symptoms you should worry about. Blood pressure medications, common side effects, mild lightheadedness when standing up quickly, slight fatigue, dry cough, with ACE inhibitors specifically, symptoms to report immediately, severe dizziness or fainting, irregular heartbeat, swelling in the face or throat, extreme fatigue, statins for cholesterol, common side effects, mild muscle aches, minor digestive upset, symptoms to report immediately, severe muscle pain or weakness, dark-colored urine, unexplained fatigue, yellowing of skin or eyes. A study in JAMA Internal Medicine found that while muscle pain is common with statins, severe muscle breakdown, rhabdomyolysis, is rare. Your doctor can check a simple blood test if you're concerned. Diabetes medications, common side effects, mild stomach upset, changes in bowel habits, symptoms to report immediately. Severe low blood sugar symptoms, shaking, confusion, rapid heartbeat. Severe abdominal pain, persistent vomiting, signs of dehydration. Antibiotics, common side effects. Mild nausea, loose stools, yeast infections, symptoms to report immediately. Severe diarrhea, especially if bloody. Severe allergic reaction, difficulty breathing, severe skin rash. The interaction factor. Here's something many people don't realize. Symptoms can result from interactions between medications, not just from individual drugs. Common problematic combinations. Blood thinners plus NSAIDs, like ibuprofen. Increased bleeding risk. Multiple medications that lower blood pressure. Excessive drops in blood pressure. Multiple sedating medications. Falls. Confusion. Certain antibiotics plus diabetes medications. Dangerous drops in blood sugar. Even over-the-counter medications and supplements can interact. Antacids can interfere with the absorption of many medications. Grapefruit juice affects dozens of common medications. St. John's wort can reduce the effectiveness of blood thinners and many other drugs. Keeping track. Your personal monitoring system. The best tool you have is good record keeping. You don't need anything fancy. A simple notebook works perfectly. What to write down? Date and time symptoms start. Exactly what you're feeling. Be specific. Dizzy when I stand up, not just dizzy. What you were doing when it started. How long it lasts. What makes it better or worse. A severity rating, 1 to 10. Also track when you take each medication, any missed doses, new medications or supplements, changes in diet or activity. This record is gold when you talk to your doctor. Instead of saying, "I've been feeling off," you can say, "I've had dizziness when standing up, rated 6 out of 10, starting 2 hours after my morning blood pressure pill for the past week." Questions to ask your doctor. When you start a new medication. 1. What are the most common side effects I should expect? 2. What symptoms would mean I should call you right away? 3. How long should I wait to see if side effects improve? 4. Are there any specific interactions with my other medications? 5. Should I take this with food or on an empty stomach? When you experience new symptoms? 1. Could this be related to my medications? 2. Do we need to do any tests to rule out other causes? 3. If it is a side effect, what are my options? 4. Is it safe to continue this medication while we figure this out? 5. How urgent is this? Preparing for your appointment. Bring these items. Your symptom diary. A complete list of all medications, including supplements and over-the-counter drugs. The actual medication bottles, if possible. A list of questions. When to use urgent care versus calling your doctor. Call your doctor's office first for mild to moderate symptoms that aren't immediately dangerous. Symptoms you want to discuss but aren't worsening rapidly. Questions about whether symptoms warrant immediate attention. Go to urgent care or ER for symptoms on the never ignore list. Severe pain, high fever with other concerning symptoms. Anything you think might be a stroke or heart attack. Resources and support. The FDA's MedWatch program lets you report side effects directly. www.fda.gov MedWatch. The National Institutes of Health has a database of drug information. www.nlm.nih.gov Medline Plus. Many pharmacies offer medication review services. Ask your pharmacist about this free resource. Working with your pharmacist. Your pharmacist is an underused resource. They can review all your medications for potential interactions. Explain side effects in plain language. Suggest timing strategies to minimize problems. Help you understand which symptoms to watch for. Show you how to properly use inhalers or injections. Don't hesitate to call your pharmacy with questions. Build a relationship with your pharmacist by using the same pharmacy consistently. They'll have your complete medication history and can spot potential problems. Creating your medical team. Think of your healthcare as a team effort with you as the team captain. Your team includes your primary care doctor, your specialists, if you have them, your pharmacist, your family members or caregivers, you, the most important member. Make sure each doctor knows what medications other doctors have prescribed. Bring your medication list to every appointment with every provider. Remember that every person is different. What works for one person may not be right for another. Your age, other health conditions, kidney and liver function, and even your genes affect how you respond to medications. Always discuss any new symptoms or concerns with your doctor before making changes to your health routine. Don't stop medications on your own, even if you think they're causing side effects. Your doctor needs to help you weigh the benefits against the risks and find the best solution for your specific situation. The goal isn't to live without any side effects. That's often impossible when treating serious conditions. The goal is to find the right balance where you're effectively managing your health conditions without symptoms that significantly reduce your quality of life. I want you to feel empowered to speak up about symptoms. You know your body better than anyone. If something doesn't feel right, say so. Good doctors welcome this information because it helps them take better care of you. If you found this information helpful, please subscribe to Senior Vitality Clinic for more evidence-based health education designed specifically for people over 60. We cover topics that matter to you, explained in clear, practical terms. This is Dr. James Wilson reminding you. You're not just managing diseases, you're maintaining your vitality and independence. Being informed and proactive with your healthcare team is one of the best things you can do for your long-term health. Thank you for watching, and I'll see you in the next video.